Welcome to the Distinctive Dermatologist, the podcast for professionals in dermatology. Our goal is to help your practice stand out and deliver the ultimate experience for your patients, so they schedule repeat visits and refer your practice to their friends. We're here to help your practice become more profitable. Here's your host, 7-time best-selling author, in-residence faculty member at High Point University, Hall of Fame professional speaker, and member of the Sales and Marketing Hall of Fame, Scott McKain.
Welcome to this week's edition of the Distinctive Dermatologist, brought to you by Gentle Cure from Skincare Oncology. Gentle Cure, tough on cancer, easy on skin. And I'm very excited about this week's episode because I think I got spoiled. When I first started doing work with the folks at Gentle Cure, I had the privilege of meeting several dermatologists, and one of the first I met was our guest for today. And I just I got spoiled because I started at the top. Dr. Agha, thank you so much for being here today, and I'm honored that you would take time to join us. And I've certainly enjoyed our conversations in the past, and I've really been looking forward to today. So it's
thank you for the kind introduction, Scott. Yes, anytime I have a chance to chat with you, it's a privilege for me. So thank you.
It's my honor. I appreciate it so much. I admire what you have done and are doing with your practice in the Chicago area, and you're obviously one of the leaders of the field and leaders in the industry. So I appreciate your time. I know it's very valuable. And I'm just curious, and I know that those that are listening and watching would really be interested to hear about your journey, about how did you become a dermatologist? What attracted you to the field? I'm just curious about your pathway and your journey. Would you please share that?
Sure. So my journey lasted 17 years. So I'm an immigrant, and I immigrated here in 1993, and I went to the University of Illinois, and then I pursued a master's degree in physiology, and then I pursued 4 years of medicine, and then I did 1 year of internal medicine. I thought it was very important because dermatology is really, there's a lot of internal medicine that's involved in it. A lot of times we diagnose many things that we see in general medical dermatology, such as diabetes and high blood pressure, and in my case, also phlebology, which is a study and treatment of varicose veins. And then I did a research fellowships in electron microscopy. So I was an electron microscopist for a couple of years, and we're very visual in dermatology, so we see things and we recognize it. A lot of people say, we find our careers. I think our careers find us. And I'm very attracted. I look at something, and it's just gives me such gratification to look at something and diagnose it. And then I pursued a clinical trials fellowship at Northwestern University, then went to Indiana University, and I got mentored by world-renowned mentors, very kind people, and at the top of their game. One of them is Dr. Stephen Wolverton, that I will always acknowledge, and I promised him to acknowledge him anytime I can. May he rest in peace. And then I pursued a fellowship with Dr. William H. Beeson. He's a facial plastic surgeon, and that's very interesting because typically, we don't really interact much with plastic surgeons, but he's a tremendous facial plastic surgeon, and he's very responsible for a lot of success in my career. And then I decided to open my own practice. However, I did join the academic department at the University of Illinois and at Jesse Brown VA because I'd love to continue teaching, especially dermatology residents. They're brilliant. They always stimulate your mind and they challenge you. So I did that while opening my own practice. So I'm an independent private practitioner in a suburb called Oak Brook here in the Chicago area. So that's my journey.
Wow. Now, first of all, there's no prejudice on my part because I'm a big Indiana University fan. That's my favorite. I went to a small liberal arts school near Indiana University. I don't know if I've shared this with you.
No,
he's a great friend of mine. I have known Dr. Beeson for years. He was at my wedding. He came to my wedding. I have known Bill, and I have been the beneficiary of not only Bill's friendship, but also of Bill's talents. He is an amazing surgeon. He is an amazing person.
Yes.
And I was blown away when you said that. He is, and like you say, he's a remarkable person because he transcends his own specialty. He helps people. He is just a wonderful, wonderful person. So you were in great hands.
So in addition to teaching me to be an excellent surgeon, I remember Dr. Beeson said something to me on the first day of fellowship, and he said, Rania, what makes an excellent surgeon? And I said, skill. And he said, no. He said, look, at our level, we all have great skill, but that's a good surgeon. But a great surgeon knows how to manage a complication of his work. And that really changed my practice. It changed how I think. It changed how I practice, even prescribing medications. For example, when patients ask me, can you prescribe this for me? I say, I can, but I never prescribe any medicine that can potentially cause you a side effect that I cannot manage. So these are lifelong lessons. But also, Dr. Beeson got me started on the path of advocacy. So because of him, I became very active at the AMA and served as a Young Physicians Section representative, and I continue to serve on the Dermatology Section Council for patient advocacy and physician advocacy. So that's another whole thing that I'm very passionate about, that we lobby for our patients, for many hurdles that we encounter in medicine in general, such as prior authorizations and insurances and all of this. It's Dr. Bill Beeson who actually got me started on this path.
I am gobsmacked. I am flat out amazed. One of the things I admire about him, and I've admired about you, and I didn't know the connection too, is that as when I started as a real outsider, working with skincare oncology, it fascinated me that you could become a dermatologist without taking any courses on the customer patient experience. And Dr. Beeson is fabulous at the patient experience. You are obviously fabulous at the patient experience. And the proof is in the retention of patients and the referrals that you get from patients. Would you talk for just a little bit about the importance of, you're talking about advocacy for patients. Would you talk a little bit about the patient experience and how you deliver it at your clinic in Illinois?
The patient experience starts in my office when the phone rings. And I am very keen. And when the phone rings, the answer here is, thank you for calling Summit Dermatology. This is so and so. How may I help you? Because we thank the patient for calling us. And I always tell my staff, no patient, no practice. Okay. And they choose us. They choose us for a reason. And they choose here because of me. I have a very special relationship with my patients. And I always say, look, if you upset one patient lost is 1,000 patients lost. And that impression will be long lasting. And we lose this, not just from a business standpoint, but from a relationship standpoint. The other thing I instruct them, the front desk specifically, I say, you are my image outside. You are me outside. Patients get greeted, patients get asked, they know them by name, and sometimes they ask for them. But also, more importantly, in the exam room, I am very big on representing the patient's interest, and also I always tell my staff, you don't know what quote-unquote package does every patient come with. You don't know who's been in a car accident getting here. You don't know who had a job interview coming here. You don't know who had lost a child and they're coming here. And it happened. And I ask every patient to establish rapport with them about what do they do. I want to connect with them. I do this because I love it and I really enjoy it. And I wouldn't have it any other way because I have this special relationship with them. And for some reason, I give you an example. For the past couple of weeks, I called it, National Reconnect with Dr. Agha Day, because every patient that I saw had seen me in 2018, 2017, 2016. And I always joke and say, hey, before we met each other, there was no COVID because COVID was such a big event in our lives. I say, hey, this was before COVID, before this. And they come back. And, when they leave, I say, hey, thank you for thinking of me again. So they need to know that they are appreciated. Yes, we deliver the best of care excellence. And I joke with them, I say, this is the Gucci of dermatology. And it is. We are specialists. We handle tough cases, and they are here for the expertise that I'm going to provide them. So we spend time with them, talking skincare. I have a whole team dedicated to that, and I answer all their questions. And I say, if you have a question, you call me. I will personally answer your call. I will personally email you back, because that is, they need to know that here the level of care is different, and they deserve this. This is not, I feel this should be baseline. This should not be anything that we pat ourselves on the back to brag about. This is the norm. This should be the standard.
Yeah, it's so true. Accompanying that, could you please describe what, over the course of your career, what are some of the changes that you've seen, both clinically and experientially, with how patients are impacted by their dermatologist?
So patients now are very educated. Almost everybody. It used to be Google, now it's ChatGPT. So patients are very educated, and also the impact of skincare on mental health and skin disease. Skin burden on mental health is very challenging. And they say if you look good, you feel good. But also I add, if you look good, you feel good, and when you feel good, you do good. When was the last time that you were in a bad mood and you went donating to charity? It doesn't happen. So they reflect. Your skin reflects your health, and I believe it's healthy to want to look good. I think when you're depressed and you're sad, you don't take care of yourself. So skin disease, in addition to not just being the cosmetic part, it affects mental health, and it affects everyone. So yes, there has been a change. Patients are more aware. They are more educated. Unfortunately, skin cancer is on the rise, and we have different options now for treating skin cancer. And many patients come here, they've known a person or they had a relative who died of skin cancer, so they are more aware. So there's more awareness, more education, yet there's more confusion with the skinfluencers and the influencers and the social media. So we have to distinguish ourselves as the skin experts, and we have to understand, almost being a psychologist, to try to figure out what is the patient want. And I always ask them, I say, what is it that bothers you? Why are you here today? And sometimes they want to ask me something and they are embarrassed, and I tell them not to be. I say, you're not here just to get Botox. You're here because you want to look good, period. So let's work on that. You're not here just to get a skin check. You're here for peace of mind. So let's work on that, and let me tell you how can I solve your problem, and you're gonna have to tell me what is it that's bothering you. So yes, things have changed.
I'm fascinated by what you said too about the psychological aspect of it. I was on a program a while back with Dr. Ken Dykewald, who's a gerontologist, and he was talking about how we had, in previous generations, basically learned how to get old by watching our parents.
Yeah.
And the baby boom generation is the first generation to say, I want to keep looking young. I don't want to age like mom and dad or others in my family aged. And so that brings about a whole new, different pressure even. I mean, not only a goal, but a pressure as well to keep looking young and to keep looking. And that certainly impacts your practice and everything that dermatologists do.
Yes, and I treat a lot of teachers, for example, and think about it. They're getting generation after generation, and they're seeing, the young people, whether they're college professors or they're high school teachers, and it impacts them. We're all human. We're all vulnerable, and they see those young people coming in front of them. And it's what you mentioned about the baby boomers. I see a lot of patients tell me, I'm starting to look like my aunt or my grandma, and I don't want to look like this. And we help them. I don't say just improvement. I say repositioning things to where they were, because they don't want to look different. So you will look your age, but your skin will not look beat up. And we talk a lot about prevention also, and we talk a lot about the non-surgical, non-invasive treatments, including treatment for skin cancer, such as what we use for General Cure for skin cure here.
That's great. And that's a perfect segue because we will be right back with the final thought with Dr. Agha right after this from our friends at Gentle Cure.
I started playing golf when I was 10 years old, so I've been in the sun my whole life.
Last year, we noticed a spot on Brian's lip. We were very concerned, and we went to a dermatologist.
When I found out it was skin cancer, I was in the middle of a tournament. The dermatologist was recommending surgery, so I was going to miss time on the tour.
I saw a commercial for a treatment called Gentle Cure. It didn't require surgery and meant no time away from golf.
If you, like millions of others, are affected by skin cancer, it's important to know that surgery isn't the only option. There's another choice, Gentle Cure. Gentle Cure uses low-energy X-rays to kill cancer cells with a 99% cure rate. There's no cutting, no surgical scarring, and no downtime.
Thanks to Gentle Cure, my cancer is gone, and I didn't miss any time on the course.
We've been fortunate. We wanted to use our platform to get this message out. There are options, and patients deserve to know.
To learn more, call today or go to gentlecure.com.
And we're back. I'm curious, Dr. Agha, you are such a leader in the industry. I'm curious, where do you see dermatology going? You talked about skin cancer on the rise. You talk about the things that are changing. What is the future of dermatology?
So there's a lot of talk about AI. So obviously, there are many companies, there are many young researchers and students and residents who are interested in AI. So dermatology is one of those fields. So for example, for skin cancer detection or for rash detection. But I still believe that the future of dermatology will be probably something that's going to combine both. So it will be artificial intelligence assisted, not completely artificial intelligence, because dermatology is all about the human touch, and AI cannot touch you, cannot sit with you, cannot converse with you, cannot be compassionate to you. So I don't think dermatology is going to go completely that way, but AI will play a role. And as you know, there's a lot of shortage of dermatologists. So probably it'll be something that's gonna mix the two. But I still think dermatology is one of those fields that really requires the human touch. And remember, procedures, and this is not something that a robot's, I don't know, I may be wrong. Somebody's going to play this in 20 years. But, the excisions, the things that we do, the skin cancer treatments, and maybe injection of, the injectables, the Botoxes and the fillers of the world. So I think it's going to advance for better detection, for example, of skin cancer, but the human touch will always remain there for dermatology.
It struck me when you're saying that there's a reason they don't call it artificial wisdom, right? It's artificial intelligence, but it's not artificial wisdom, because the wisdom has to come from professionals and experts such as yourself. We're just about out of time. I'm just curious if there's any last message that you'd like to leave with us and the viewer and the listener.
Well, first of all, I want to thank you for this. I truly enjoyed it. Dermatology is one of those fields that, we take a lot of pride in dermatology. The American Academy of Dermatology has a hashtag that says your dermatologist knows. So whether it's for, the patients, the consumers, to know your physician, know your doctor. Is this a board certified dermatologist? Is this somebody who went through the training? And ask the question. I also have a series that says, on my social media, it says demystifying dermatology. So it's one of those fields that there are a lot of myths in dermatology, and so know your physician, know your doctor, know their credentials, and always ask questions.
That's perfect. Well, Dr. Agha, thank you. It's always a privilege and pleasure to talk with you, and I really appreciate your time and appreciate you being with us. Thank you for joining us on this edition of the Distinctive Dermatologist. This is Scott McKain. I look forward to seeing you again on our next episode next week.
Thanks for listening, and join us next time for the Distinctive Dermatologist with Scott McKain.